Hello and welcome to the third session of our Suicide Bereavement e-learning module. In this session, I'll be talking about how you can support kids grieving a death by suicide. So these will be some really helpful tips. I know we've talked about the prevalence of the problem and kind of what these kids experience, but our role in this organization is trying to make sure that we help and support these kids. So we need an understanding of what the problem is in our society, how prevalent it is, what the scope of the issue is. We need to know on an individual level what kind of their experience is, what their struggle might be, how it presents in forms of suffering, again, psychological, social, educational, whatever the impacts may be. But with that insight and understanding, how do we direct our efforts to supporting them in the best way? So understanding some factors that may contribute to suicide will help when talking to young loss survivors. So you want to encourage remembering. I think we said earlier that they may avoid memories of the person or the death because it was so traumatic or it brings up such intense emotions. So obviously gently and with a lot of encouragement, we want to encourage them to remember, but not force them to. And if they do remember, just being a listening ear and facilitating more conversation with some kind of active listening skills. Many teens will encounter social stigma, making them feel uncomfortable or unwilling to talk about the person who died. Teens and children benefit from remembering and talking about the person that they lost. So encourage them to share any memories, tell stories, even if it's just funny stories that are associated with the lost person. Ask any questions and help them establish some rituals that help them kind of connect with those memories of that person. Of course, because these kids or adolescents often feel the world is an unsafe place or that people can't be trusted after experiencing something like this, it's really important to try to comfort them and embody kind of a safe person. So give them comfort, of course, with permission if they do like hugs or other forms of kind of that kind of affection. Give them hugs and reassurance verbally, anything to just kind of set them at ease and starts to build rapport, especially if you're in one of our camps and you're mentoring a child. Just explore with them what's a way that they like to be comforted. That's always a really great conversation to have. Not all kids like hugs. It might be just give me a high five every once in a while, or maybe just don't even touch me. Just when, we're out and about, just listen to me. Just need someone to listen. So reassure the person that grief is normal and there's no wrong or right way to grieve. Whatever is coming up for them is natural, and we shouldn't try to force or fix or change whatever's coming up. We want to almost make space for it, understand it, and that way we can kind of move through it, especially if they start onboarding some of the tools and coping skills that are taught in all of our programs at Feel the Magic. We want to use language that is familiar and easily understood. As I said before, we also want to use language that's somewhat direct. And I know that sometimes it may sound a little bit harsh, such as, that person died by suicide, or so-and-so killed himself. However, the ambiguous or the watered down language can be confusing for kids. So, and a lot of times these kids, actually appreciate you being direct with them and treating them a little bit like an adult. But of course, you need to give kind of adequate but age appropriate information. So that's going to be kind of a judgment call for you. There's certain language that you probably wouldn't use with an 8-year-old, but you might want to with a 13-year-old. So again, and if you have any questions about like specific cases, because I can't address every scenario, pull someone over like myself or another mental health professional on staff at Feel the Magic, and we'll help kind of walk you through what that would look like. validate that this can be a really confusing time for adults, let alone children. So that if they're experiencing confusion or overwhelm, that it's natural that these things don't just occur for kids, that adults have a hard time too. And we all need each other to get through it. So a lot of times people ask, well, how do I speak to a child bereaved by suicide? And I'll just give you a few pointers. If you've been through our counseling module, you'll notice that there's some overlap here, but I do want to highlight a few things in this session as well. So listen without judgment. They're going to be hyper vigilant to potential for judgment or criticism or stigma, and we want to destigmatize their experience. So just in a non-judgmental way, be their sounding board and listen to what they have to say if they're willing to tell their story, and reflect certain emotions back, like that must have been really, you must have been really sad, or even that must have been very confusing for you. And a lot of times that'll trigger them to just continue and elaborate on their experience, which, as we know, helps them process their grief. If they're verbalizing it, they're organizing their thoughts and feelings a bit better in their mind, and it helps with, the cognitive and emotional processing. So when young people are grieving, adults can be quick to offer like advice or give opinions or make judgments, trying to fix the problem, and we really want to avoid that. If we ever do offer advice, it's after we've done a lot of listening and just sat with the problem together, not immediately jumping to solve it or even ignore it. And if you ever give advice, you always ask permission. Hey, do you think I could tell you what I think about this, or would you be interested in hearing how I might go about this? We don't want to impose so much agenda on them, and it gives them a sense of agency and empowerment being one of our core values at Feel the Magic, if you make it their choice whether they receive your insight or advice. So listen without judging, interpreting, or evaluating what they're saying. If anything, just reflecting back maybe little snippets of what they've said so they know that you're listening. So you can simply repeat parts of what they said, and that makes them feel heard and almost seen for what they're experiencing. Or reflecting back emotions that you see they might be experiencing in the moment, or they must have experienced at the time of experiencing these events, whatever they're describing to you. Once children or teens trust you, they'll be more open to listening and receiving your support. If they are not ready to talk, reassure them that you are available to them whenever they feel they are ready to talk. Many children worry that asking questions will upset an adult, so just reassure them that it is okay to ask whatever questions they have. And you don't have to feel pressure to answer all these questions. You can say, I'll answer some of your questions to the best of my ability, but there are some questions that even us adults don't really know. And if you need maybe an expert opinion, you could ask one of your facilitators who's a mental health professional. Again, you could come to me if I'm around, or whoever the head psychologist is for your camp that time around. So you're not alone. Don't feel pressure to answer. And if you don't have the answer, just be honest. And kids appreciate honesty. So with regards to social stigma, many children or teens feel shame and a sense of negative judgment from others about the death. So you being more openly communicative reduces some of this shame, because it's not reinforcing this perceived stigma that they might have. Reassure them that having a sense of relief doesn't mean that they wanted or caused the person to die. So again, we discussed this earlier, that if they witnessed this person who died by suicide experiencing a lot of mental anguish because of a mental health issue, or even a substance issue or addiction, and then they're like, okay, well, that's over. At least they're not suffering anymore. Just acknowledge that relief is natural. And of course, they're not only feeling relieved, they're probably feeling relieved and sad and all of the other things. So just because they have a little slight bit of a pleasant emotion like relief doesn't mean that, they're a bad person. Actually, it shows that they care about that person's no longer suffering. So some people avoid talking to those bereaved by suicide out of fear of saying the wrong thing or making the situation worse. Again, you don't really need to say or do anything in particular as long as you just create a forum for them to feel like they can open up about their experience. If you have doubts or you worry about saying the wrong thing, run it by a peer, or better, come to a facilitator or myself, and we're happy to talk through that so you have more confidence going into that situation. The silence of other people, though, can reinforce the isolation, stigma, and shame they may already be feeling. So definitely allow for open conversation. And if you don't know the right thing to say or you don't have the answer to a question, simply state that. And that's okay. I'm not actually sure. That's actually confusing for adults as well, is a perfectly all right answer. Be aware that many children and teens bereaved by suicide are very sensitive to being left and maybe more clingy or fearful, tearful, less confident. So you might need to be quite vigilant and have patience with those who are experiencing some potential separation anxiety, and just keep reminding them that you're there. Reassure them that you're available. A simple "I got you, we got this" kind of attitude makes them feel really secure, because a lot of them are separated from the surviving caregiver, so they're going to be really sensitive to, do I trust the people around me? Am I in good hands? So just maybe taking a little bit more effort to verbally reassure these kids that you got them, you're there for them, you're available for their support. Now, because we're talking about suicide in general, and we have talked about how experiencing the death of a parent who has committed or who has died by suicide, or a sibling who's died by suicide, there is increased suicide risk. So you might have to be aware if someone is displaying signs that they're at risk of harming themselves, or having some suicidal behavior. So what you want to pick up on in a proper suicide risk assessment is, the extent of their psychic pain, their distress level. So what's the nature and level of their inner distress? What are the sources of their distress? So just get an understanding of that. So obviously if they're a 10 out of 10 on our distress meter, that's really serious. What's the meaning and motivation? So basically, what's the understanding of the predicament or whatever is going on, the events that are happening? What is the motivation, or what's motivating the person to harm themselves or herself? Because more serious events may prompt more risk of action. Has the person lost his or her reason for living? So have the events maybe taken something away that was really essential for their purpose in life? Does the person believe that it might be possible for their predicament to change, and that they might be able to bring this about? If someone's less confident that the situation can change, they may be more at risk, because it breeds this sense of hopelessness. You want to pay attention to at-risk mental states. So the presence of certain at-risk mental states escalates the level of suicide risk. This could be level of hopelessness, despair, agitation, shame, anger, and guilt. These emotions may be associated with specific body language and other nonverbal cues. So look for and directly inquire about such feelings and the extent of them, of course. So does the person have a history of aggression or impulsive behavior as well? More aggression or impulsivity obviously makes them less predictable and potentially more at risk of harming themselves. You might already know this, especially since we are in a module talking about bereavement by suicide, but what's their history of suicide behavior, not just their own, but exposure to it. So, have they felt like this before? Has the person harmed themselves in any way before? What were the circumstances and details of those previous circumstances? Um, are there similarities in the current circumstances? Is there a history of suicide in the family, or even in their friendship group? So, a history of a suicide attempt or self harm elevates a person's risk of suicide. You want to think about just what are the nature and the intensity of the suicidal thoughts. So, what thoughts are coming up? What feelings are coming up? When did they begin? How frequently are they? How persistent can they be? And can the person control them? What has stopped the person from acting on these thoughts so far? That might even kind of spark a conversation about how they're going to cope. Of course, we want to think about, well, what's the lethality of some of the thoughts that they're having and the intent associated with that. So, what is the person's degree of suicidal intent, or do they really intend to act on these thoughts? The more they intend to act, obviously the bigger risk. So we always talk about that when doing a risk assessment, is what's the intent? How determined are they? So have they really planned this out and they're sure they're going to follow through with this? That's definitely something to look out for. Was their attempt carefully planned or impulsive? So you just want to think about if they have a plan and how much they've developed that plan. Obviously, the more they've developed a plan, the more they've probably sat down and thought about it, which brings them to risk. It's important to assess the level of intention and the person's understanding of the level of lethality of their suicide attempt or plan. So, yeah, even if you have an understanding of how lethal their plan or what they're intending to do is, you need to understand what they think about that. And because we're talking about kids, they may have a very strange sense for the lethality of what they're thinking of doing, or even the level of finality that, what they are thinking of doing will have. The other thing, and we've talked about it just then, is the presence of a suicide plan. So, how far are they in a process of planning some type of attempt? Has the person made plans in the past? Is there any specific method, place, time that they're thinking of doing something? How long has this plan been in place? How often does the person revisit it in their mind? And how realistic are the plans? Sometimes they're very unrealistic. Sometimes it seems very feasible that they could follow through. So just keep these things in mind. You also might want to assess the means by which they would do something, or their knowledge about means. So does the person have access to any lethal means? And a lot of times we talk about like firearms in particular, but other means might be quite lethal as well. Is the method that they're choosing reversible, or is it quite final, like a shooting, unfortunately, or jumping off of a cliff where there is no going back? And has the person made any special effort to find any information about methods of suicide? You might notice internet searches, specifically maybe about carbon monoxide and that kind of thing. So just maybe ask, like, how much have they looked into this? This is only if you're really concerned they're showing signs that they could act on something. And obviously all of these things are just to assess just the level of risk. Kind of more positively, you want to think about, well, what's their coping potential and capacity? So, of course, as you're doing an assessment, it's making them think about it more. But toward the end of assessing for these things, it's kind of a nice reframe to begin discussing any personal strengths or effective ways they've coped with difficult times in the past. Now you have them talking in a more hopeful and positive way, which will be a protective factor in getting them through this episode, whatever they're experiencing. So how have they managed previous difficult life events and stressors effectively, and remind them of all the support they have around them. So family, friends, community, some people are close with their church, yourself as a mentor, if you're there supporting them, the facilitators of your group, whatever program you might be a part of, and the Feel the Magic staff who, have seen kids experience quite a range of emotions and intensity of emotions, and we're trained to help them navigate those. So just remind them of those supports, or even bring them to us so we can support that child. So a lot of times when we're speaking with children, we want to just talk in constructive ways. And a lot of these ways of speaking with them can almost be life-saving in your approach. Inevitably, we want to empower them with the tools that they need in order to cope, so they don't feel powerless in the face of what seems like such an overwhelming and damaging form of grief, that grief by suicide. So that concludes this module. Before I leave, though, I just want to go back to a program I mentioned before, the Let's Talk Suicide program. In the vein of supporting those bereaved by suicide, we at Feel the Magic have created a program specific for them called Let's Talk Suicide. And it's a virtual grief camp for children and adolescents aged 7 to 17 that gives grieving kids tools and coping skills for managing their grief, as well as a community to lean on after there's been a suicide in their family, whether it be a parent or a sibling. Sessions are held via Zoom in small groups of about 6 to 8 children or adolescents, depending on their age group. And they're divided between age groups of 7 to 9, 10 to 13, and 14 to 17. So they're within they're in groups with people of similar ages. And those groups are facilitated by trained counselors or psychologists and trained people with lived experience of a suicide death in the family. It's really important that we have someone on hand with lived experience. A lot of times, them being able to kind of explore or tell their story, it creates a good role model for those in the group. And it also starts to, take down some of those barriers and dividers, and reassure them that there are other people that have experienced this and actually have gotten through it and are now helping others suffering. And then, of course, the trained counseling or psychology professional has kind of the academic experience and training necessary if, really difficult circumstances arise. So thank you so much for paying attention in this video. I hope you found it helpful, and thanks so much for listening.